So my name's Maria, and I'm assuming your name is Boris.
That is the name I was given at birth.
Boris the PA. All right, very cool.
Yes. So I actually have a very small list of questions, but did you want to introduce yourself before I go into that?
Yeah, absolutely. So my name's Maria. I've been a practicing PA for almost 3 years. I'm in the Detroit area, like Metro Detroit area, and majority of my time has been in psychiatry. So for about 2 years, I did community mental health, around like a little less under 2 years, and then after that, I did pain, palliative, and addiction for less than a year. And then I switched back into, psychiatry, but in the crisis setting, not too long ago, about like 3-ish months ago. And I work a night shift, and it's actually so nice. It's so nice. I love it.
You know what? I think that's what got my attention the first time I saw one of your videos is you're doing stuff that most people kind of steer clear of. You're working at night and you're working with psych.
I know. People, I think I'm in a very unique. I think I'm in a very unique setting. So I can explain that more. Like as individuals have questions, and if you have questions as well. But yeah, I was honestly I'm not gonna lie, when I applied for this role, I was absolutely terrified.
I would be.
I'm in the city. And I'm at night shift, and I'm working like psych in the city in crisis. So I've never worked crisis, right? I've never worked in a psych ED. Most of my patients in CMH, they were high acuity, but for the most part, they were stable. Inpatient, palliative addiction, nothing of the sort. So I think when you hear crisis center, psych ED, you're a little bit more scared.
Yeah.
'Cause you don't know who's going to come in.
Hmm.
So yeah, I too was very, very a little nervous to apply to such position. So yeah. How about you? What is your path or?
Yeah. I think we graduated around the same time. I graduated in the fall of 2021, so I've been practicing about 3 years, just like you.
Yeah.
And I started in actually internal medicine outpatient, so kind of like primary care for adults. And the only reason I was in that was because it was by far my favorite rotation with the most brilliant internal medicine doctor I've ever met.
Yeah.
So, I mean, my school was in Syracuse, New York. I didn't really want to stay in Syracuse, New York, but this guy was so amazing. I stayed, as long as I could tolerate. And I wanted to work hand in hand with him. And it was kind of like the dream position because it was literally a physician-owned tiny little practice, and he trained me like myself from the ground up. I always had his advice. It was awesome.
I
You
think
know,
that's
so,
the way to go. That's the way to start.
yeah. So a lot of people join like a big practice, and then they get inconsistent oversight. They don't really know who their supervising is, and they just figure it out on their own. I had this guy's experience right there for a whole year.
Yes.
You know.
Yeah, it's same. When I started at my CMH, it wasn't a physician owned clinic. It was like a bigger clinic, a bigger CMH, and then they had a family medicine right across from us. And then we had psychiatric health right across, another branch of it. But the physician who, excuse me, essentially who hired me, he taught me everything. I felt like I was mentored under him, and
Yes.
even a point of time where we'd have one-on-one meetings for an hour to go over complex cases. Starting off in CMH, if you're interested in psychiatry, I would say starting off in in a CMH setting or even in an inpatient setting, even though I haven't worked inpatient, I think that's the way to go. I think you're going to be exposed to so much, and I agree with you. Having that one-on-one supervising physician, collaborative physician, whatever you want to call it, It's so important.
Yeah. They tell you, like, for your first PA job out of school, you can kind of pick between 2 out of the 3: salary, location, specialty.
Yeah.
So, like, you might work in the specialty you want, but it might not pay very well, or it might be in a city you don't want to work in. I would say, honestly, specialty first, like, decide what you want to do. And then I would go with, like, what the scenario is. If it's like a smaller physician-run clinic or somewhere where you will be mentored, I would pick that, even sacrificing salary and location.
I agree. I 100% agree. Because you will always, like, so in Michigan, the salary is very different from New York. So when I made that salary transparency page, I felt like people were coming for my neck. They were like, "You're not getting paid enough." Da, da, da. I was like, "I'm in Michigan." Like, I was like, "This is a great, like, this is the average starting salary, like, salary report in Michigan, at least in 2022. Like, this is what we started with." But I agree, because you will, like, over time, with more experience, like, if you want to switch positions and switch your role or jobs for salary, like, you'll make back that money because you've gained experience.
Yeah. Right? And I think you said you started with like $100,000 a year?
I did. I started at $100,000 a year, yes.
And that was outpatient psych, 40 hours a week.
Yep. Actually, it was 35 hours a week, but it's never really 35 hours a week. It was, it's never really 35. It was, yeah, like 40, 45, but like I was listed 35. And then after a year, I was getting burnt out. We became really understaffed. And the patients that we were seeing, it was just like, no place is perfect by all means, but there was a point where I just felt like I was getting so burnt out, and it was kind of like ridiculous. And then so I had gotten other offers in other places. I had gotten like an IM offer, and I understood the IM offer was going to be lower because I had never worked in IM or family medicine or primary care, which I was understanding, but I didn't take it because for me, like, work-life balance was really, really important. I hated taking work home. I hated being anxious all the time. I hated, like, I had a laptop, and like sometimes it was a laptop provided by work. And sometimes, like, my laptop would ring. Like, it had a little phone on it, like a mobile phone to call out my patients. And it would ring and it would ring and it wouldn't stop. And I would turn it off. And then I would listen. I just naturally would listen to the voicemails. And you're dealing with such, like, complicated patients. So, like, I listened to that voicemail and I was like, dang, I really wish I didn't listen to those voicemails. But, yeah, so, I rejected quite a few jobs because the PTO that they were offering was like 10 days or 14 days. And I'm just like, in medicine, like, I tell new grads, I'm like, do not take a position that only gives you 2 weeks of PTO.
Yeah, as a provider, that's a joke.
It's a huge joke. I don't know what they're thinking, especially with COVID. Like, I had COVID one time, and I think it took me like a solid week. Like 7 days to recover. And there goes 7 days.
Yeah.
And so you were in IM. Where did you go after that?
So I spent about 1.5 years in IM, internal medicine, which is like primary care for adults, outpatient. And I mean, there's obviously a tremendous amount to learn in IM. And I thought, like, I would work for this guy for years and years, learn everything he knows, or a lot of things he knows. But after a while, I noticed that I was seeing the same thing over and over again. And I was saying the same thing over and over again. Like, all right, you're 10 pounds heavier this month than you were 2 months ago. Now your blood pressure's up. Now we got to start you on blood pressure meds. Yeah. And it was just the same, like, negative cycle that I couldn't do anymore. Yeah. And like everyone says, well, good providers focus on like social determinants of health and behavioral components and like actually like trying to get people off medications. But like, dude, nobody listens to us. No, like, nobody wants to do the hard work. They just say, fine, give me a pill. And I couldn't be part of that anymore.
Yeah, it's exhausting. I completely understand. And like, it's so difficult to address like social determinants of health in a 15-minute conversation, right? And it goes beyond like you and us and the patients. Like this is like beyond both of us. Like something else is at play here, where they're not, where they're something is a struggle. Like, and this is, and I think we've all realized this, like over what, I don't know the statistic, but like what, over 50% of the US is dealing with some sort of metabolic issues, right?
Yeah, much more than that.
Significantly much more than that. So I think there's something significantly bigger at play that goes like, why is it more than 50% of the patients, you know? And it sucks. It really, really sucks that our population is just getting sicker and sicker. And I think it's beyond our control. It sucks.
Well, so from an internal medicine background, and also the supervising physician I had was certified in weight loss medicine. He was an obesity doctor.
That's awesome.
And like he thinks that's the tip of the spear. You know, the weight goes down, so does the diabetes, so does the blood pressure. In your realm, so does depression and anxiety and all that stuff. It's all linked. Because they're all pro-inflammatory states, or the pro-inflammatory state of obesity is what causes all this like terrible suffering.
Absolutely.
Yeah. It's not, the thing is, it's not the patient's fault. Like we can say it's like lack of self-control, they're eating the wrong things. Well, that's because 99% of the grocery store is the wrong thing. And then like they go to me and, I'm sorry, Samosa Queen, what is your first name?
I'm so sorry, Maria.
Maria. Okay, you said it, but I forgot, I'm sorry.
No, it's totally fine, it's fine.
Yeah. And so then 20 years of this goes by and they come to me and Maria and they're like, okay, I'm depressed, I have high blood pressure, I like high blood sugar, I can't feel my feet because of, because of diabetes, and fix me. And we're like, you needed me 20 years ago to tell you to quit eating that. Yeah. And that's the part I just could not be involved in anymore. So that's why I switched to acute care. And now I'm in urgent care where I like fix, problems as they come. And I don't manage this like train wreck of a long-term care situation.
Absolutely. I totally get that, because in crisis center, crisis is almost like, it's like a psych ED, right? It's like acute care for psych. And I was feeling that burnout, because how can I fix 20 years of trauma?
Right.
Or 25 or 30 years or 50 years of trauma? Like, yes, we were mitigating symptoms. We were decreasing like severity of symptoms for sure, but you feel defeated. Like you feel a sense of guilt and a sense of shame. Like you're like, I don't know how to fix this. Right. And I don't think respectfully, we should be expected to, because this goes beyond me and you. Right. So for example, like just in general, like diabetes and high blood pressure and like all of these, like those eating habits, like probably stem from like childhood, most likely. Like, no, I don't know the population you were working with, but like the population, I was working in a community mental health setting, and like a lot of my patients were overweight, right? And they were low income, but their parents worked like 2-3 jobs. And so like, even now, I don't know if you deal with this or you struggle with this. Like I myself struggle with cooking dinner and cooking lunch. And like, I actually don't, in fact, I'm embarrassingly, like I DoorDash almost daily.
Likewise. Like you don't have time, especially at work.
I don't have time. I don't have time. You don't have time. Like who has time? And people with kids, I don't have kids. Do you have kids?
No. I mean, I'd like to one day, but I imagine like whoever I end up having kids with, I would kind of like them to be at least partially stay at home.
Yes.
And deal with all the stuff that I literally outsource to DoorDash and to all this junk.
Yes.
This would be healthier and better.
Yes.
The amount of money I make is like fine to afford that, but for most people, they probably can't. So like they're both working and they're both like eating all this junk that's like out there, and it's such. So the thing is, this isn't an issue almost anywhere but the U.S.
Yeah, I don't know. I don't know significantly about other countries, but like I will say, like my cousin. So I'm Pakistani. I was born in the United States, but I'm going to start walking around. I'm Pakistani. But she told me that it's shocking to see that we have like leftovers. Like when I don't know, like she said this, she was just like, it's so weird that you guys like have leftovers. And whereas like at home, we were getting like 3 fresh meals, 2 fresh meals a day. And I was like, I'm embarrassed. I was like, I'm embarrassed by that as well. Like, I don't know how you, but they also have like a significantly lower cost of living. She comes from a pretty well-off family, but I would say middle class there, they're able to afford help. Right. So by afford help, I mean someone to, you know, kind of clean the home, take care of the home, cook as well, you know, take care of the parents. So they were able to afford help. Whereas like here, like we are both the housekeepers, the maids, the chefs, the workers, the mommies, the daddies, the caretakers of our parents. You know, we take on so many roles. And she says over there, like middle class at least, like you have help. And you do not only do you have help, you have help from your family. You have a village. And over here, we don't have time to be a village. We don't even have time to be individualistic, in my opinion.
Literally, there's no time for anything.
Yeah, just like in a deeper conversation, like I don't have kids, I have a husband, so it's so helpful to have a partner who's like helpful and like, well, we split up the work because it's hard to do it by yourself. It really is. That's such a random, like off topic, non-PA related, but just like health in general, the US, the state of the US in general.
Yeah, it's like financially the richest nation in the world.
Yeah.
And not highest per capita, but it's also very high cost of living. And like we're just stretched so thin to like do anything.
Yes.
You're just constantly at work.
You're constantly at work. Constantly
working.
You know, and do you do 312s? What do you do? So
my schedule varies from week to week a little bit, but we're 12s 5 days a week, and then we're 8s on weekends. So 8 to 8, and then 8 to 4.
Wait, you work 5 12s?
No. So Monday through Friday, we're open 8 to 8. So I might do 2 or 3 of those. And then every other weekend, I'll do Saturday, Sunday, which is 8s.
Oh, okay. So in total, how many hours per week do you work?
Total average of like 38 to 40.
Okay, that's awesome. Yeah, that's great. So I work 3 12s one week, and then I work 4 12s the other week.
That's not too bad.
No, it's not. It's really not. And on my 4 12s, I get 4 days off. On my 3 12s, I work like I have to pick up a Saturday or something like that. Then it becomes like 4 12s. And so I like it because at least like I think for me like the 8 to 5, 8 to 4. So when I did my ED rotation in PA school, I loved 3 12s. I was like, this is cool.
It's the best.
This is awesome because you have like 3-4 days off to like, you know, 1 day to rest or like do the things you want to do, go to doctor's appointments, get your groceries done. Like you get full days, especially when you get 4 days off. Like, I think it's great.
Yeah.
Yeah. Are you still able to hear me? Okay. Cause I am walking around.
No, I hear you great. As long as you're close enough to your phone, I hear you great.
Okay. Cool. How long have you been at your urgent care position?
So this new one, I just moved to Raleigh. So I've been here about 3.5 months.
Yeah.
The previous one, I moved around a lot. Story of my life. But the previous one, I was with that company for about a year and a half. And I was between New York and Ohio.
Okay. New York and Ohio? Like Ohio, New York?
No. So I worked for the same company that had offices in New York and Ohio.
Oh, okay. So you were in Ohio at one point?
I was in Ohio for about 6 months.
Oh my God, I'm so sorry.
That's where I grew up.
I'm just joking. I'm just kidding.
I know. No, I mean, Ohio gets so much crap for good reason. It's kind of like, why would you want to go to Ohio? But there's good stuff in Ohio.
No, like it's good. Cedar Point is so fun. Cleveland is
right. It's like the only thing about Ohio anybody cares about. No, Ohio, it's kind of like upstate New York or kind of like, you know, a lot of towns where like if you're from there, you love it, you want to go back. If you're not from there, nobody wants to really go there.
Okay, gotcha. How do you like New York in comparison?
So I was in upstate New York. I was in Syracuse,
Okay.
which honestly, being in Raleigh now, like I definitely miss a lot of aspects of Syracuse. Mainly, it's smaller. There's no traffic. You can get anywhere across town. It's like not congested. Uh, on the other hand, there's much less like nice restaurants and nice stuff to do, and like the average like socioeconomic status is much lower. So there's pluses and minuses of both.
Gotcha. What made you decide to go from Syracuse to Raleigh?
So I went to a place called Wrightsville Beach. It's in Wilmington, North Carolina.
Okay.
And like it's a gorgeous beach. And like just being there, I was like, I'm moving here. That's it. This is the plan.
Oh.
And then my buddy moved here to Raleigh, and he somehow convinced me to move here too. So.
All right. Well, cool. Are you married, or do you have?
No.
No. Okay. So you have like the ability to move around.
I have free reign to do whatever the heck I want, which is refreshing.
That's good. That's awesome. I love being married. I've been in Michigan my whole life.
Oh, okay.
I think if you're single and like, or if you're not married, like go and explore the rest of the United States. Like that's so cool.
Well, and like, be smart about it. Because like I told you, like I stayed in this like small city, Syracuse, just to like stay with that one doctor.
Yeah.
And I mean, I think that year and a half that I was there, I really limited myself because there's like not a lot of people to meet. You know, I made some good friends, but as far as like meeting somebody to marry and whatnot, it was just like, there's just no choices. It's tiny. So like being in a city like Raleigh, it's a whole different scenario. So like when you're young and you are single, I definitely go to a big city.
Gotcha. That makes sense. But yeah, let me answer some of your questions that you got.
Yes. So many tangents.
I'm so sorry. Like I go on like 1,000. I go on. That is my habit.
Honestly, I think it's good because like people watching this and like people keep popping in and out of the live. But I think once we post it as a long video, people appreciate just like getting to know us as human beings.
Yeah, absolutely.
And like these are the conversations you work with another provider. This is what you're talking about.
Absolutely. That's how I feel too.
Yeah, 100%. But this interview is mostly about Samosa Queen, who is Maria.
Yes.
So I'm going to ask a few questions, and I think TikTok records this, so we can post this as like a long video later.
Okay.
Can you describe what Samosa Queen is to you? Is that your favorite food, or why? Why
Yeah,
samosa?
that's a good question. So, samosa is like a Pakistani Indian food.
Mm-hmm.
And what it is, it's like a fried, it's like a breaded fried thing with like spiced potato in it, or sometimes you can have meat in it, and it's so good. I don't know how to make it. Like I just like it so much, and like I've been samosa queen since I was like 19, so I just like stuck with it. And like, I don't know. I think I'm just going to stick with it. I'm kind of old. Maybe I should change my name, but like, you know what? I'm just going to stick to, well, my Instagram name is Samosa Leviosa.
Like a Harry Potter reference?
Yeah, but I don't even read Harry Potter. I just watched the movies and I was like, oh, Samosa rhymes with Leviosa. Like that's what I'm going to.
Oh, you don't know Harry Potter enough to know what Leviosa means?
It was Wingardium Leviosa.
Yeah.
I watched some movies.
Yeah, it's the swish and flick, and then they like make things levitate.
Yeah, it was the first movie. The Hermione, she was like, not Leviosa, something like that. So I was just like, it rhymes. I'm just gonna keep it. Actually, I recently changed it to that, so I can't even say that I changed it a while back. So that's what samosa is. I don't make samosas. I just eat them.
Well, that does make you the samosa queen if you like them enough to want to eat them frequently.
Yeah, I know, exactly.
They're super good. I freaking love samosas. I love like all Middle Eastern food.
I love Middle Eastern food. I'm a huge fan. I think Pakistani, I don't know if it's because I am Pakistani, but like I think Pakistani food is one of my favorite food. And Michigan has a huge, I don't know if you know this. So Michigan, especially the Metro Detroit area, we have a city called Dearborn, and it's considered the Little Middle East.
Really?
Yes. And so the food there is like phenomenal. Like the amount of cuisine. I mean, yeah, different from New York. I'm sure New York has like 1,000 different cuisines, but like Metro Detroit, I think is phenomenal, like food wise, like so good, so many different types of food. Like I've thoroughly enjoyed it. Other parts of Michigan, not so much, but Metro Detroit is solid.
Yeah, Detroit's an underappreciated city.
Hell yeah. Hell yeah. I mean, I went to school in Kalamazoo, Michigan. I don't know if you know, it's the west side of Michigan. God, it was so boring. It was so boring. And it was like, this is not any hate in Kalamazoo. It's just me and my husband, like, we don't drink and we don't like go out to bars and stuff. So there's just not a lot for us to do there. And there was not a lot of food options either. I mean, there were a couple, but you just miss home. You just miss like the variety that you can get from home or where we're from.
Honestly, that's kind of like the big difference I'm seeing between like a little city and a big city, and especially like a small town and a big city, is there's just so much more like quote unquote to do, even though it's all the same stuff. It's like 10 billion restaurants, 10 billion bars, little parks in between. But it's like, for someone like me that's just kind of tired of all that, like there's actually more to do in a smaller town with like land and outdoor activities and travel and stuff. So you know, the whole big city thing is the only advantage, really, unless you really love like bar hopping and food hopping, which I don't, is the people that you meet. You know, like the sheer amount of people that you can click with, and then like you kind of find your people, and maybe you move to a smaller place.
Yeah. So Metro Detroit, I don't know how Ohio is, but like Metro Detroit, we live like, I don't want to say I live in Detroit. We live in like a city north of Detroit, and yeah, I agree. Like the city that I'm within, like it's a smaller city, but like you can like Detroit, like the city of Detroit is like 30 minutes away from me. But the smaller city, like I agree, like the people, it's smaller. You get to know people, like you can meet them, you can click with them. But I also grew up here, so yeah. Yeah.
But I'm going to move on to, why did you decide to practice medicine?
Medicine. Okay, so fun fact, I'm type 1 diabetic.
Oh man, that's tough.
Yeah, it sucks. But so I've had that since I was 8. And I think like I didn't know anything about career. If I'm being very, very honest, like I didn't know anything about careers besides being in and out of clinics. Like like my mom taking me to, my parents were very like on top of it in terms of like taking me to my appointments, making sure my blood sugars were okay, going to my, my endocrinologist, every 3 months, every 6 months, going to my ophthalmologist every year, going to my pediatrician, going to my family medicine, all of these things. Right. So like I was very much immersed into that world at a very young age. And back in the day, at least when I was like, I was the only other diabetic person, type 1 diabetic. There was not that many people, right? Like, I think in undergrad, I met like 2. And then like later on, I met like significantly more. But my brother is also type 1.
Oh, wow.
So I was diagnosed at 8, my younger brother, and he was diagnosed, I think, at like 10, 11, something like that. Okay. So I think like that isolation and like almost like feeling alone with such a chronic illness that like not other people experience, like, yeah, type 2 diabetes, but type 1 is very different. I just wanted to be in a field. I wanted to be in medicine. One, so obviously I wanted to help people who were like me. So I wanted when I was 18, before I knew what PA was, I wanted to be an endocrinologist. I wanted to be like a pediatric endocrinologist. I was like, this is what I want to do. I want to help parents like me know that like we can control this. Like we can do this, right? But like I also wanted to, I had to really think about like my priorities, right? And I didn't know what PA, like 10 years ago when I was 18, like I didn't know what a PA was.
Sure.
Like I think most of the time, like I knew what nurse practitioners were, and we obviously know what physicians are. And like the more that I learned about what a PA was, I was like, oh, like this sounds like really solid. Like I can do a similar role. I can help people. And there's a part where being a physician is very, like my brother just entered medical school.
Oh, congrats.
Yeah, thanks. He worked so hard to get in, and it is a significant sacrifice. And I don't think I could make that for myself. Like the more physicians I was interviewing and residents that I was interviewing, and then I have a cousin who was a resident. I think he just finished his PM&R fellowship. Like it was just like I was just like very put off by it. Mm-hmm. I was very put off by the culture of how medicine was treating its people. Like
physicians particularly?
Yeah, like healthcare, like the way that medical institutions, like medical schools, medical residencies were treating residents and treating medical students. And for 10 plus years, I'm like, that's like what, like 10% of, more than 10% of your life. And like, you're being treated so unfairly. And again, that psych component of like significantly higher rates of suicide, significantly higher rates of depression. Every physician I was talking to was like, I wish I just became a PA. I wish I just became a PA. I was just like, all right. And every PA that I talked to at that time was like, I love being a PA. And I was like, why would I want to do that? Right? Like, I understand that we need physicians, but they need to like take care of residents. Like they need to like appropriately pay them. They need to have normal work hours. And I just felt like we kind of got like a cheat code where it was just like, okay, like, one, you should be generally with you're going to have a good collaborating physician. If you don't, you can leave, right? Whereas residency, you might have to pick up your bags and move to a state. Like, you know, you're on the move. You don't even know where you're going to be, right? We're paid adequately. We're paid good wages for the most part, right? We have lateral mobility. So I was also like, as much as at 18, I wanted to be a pediatric endocrinologist at that time. Like now I'm in psych, right? In clinical rotations. See that coming, did you? Yeah, in clinical rotations, I loved all of my clinical rotations. So I can't imagine like being a med student and feel like shit. I don't know. Like I don't know which one to pick because I like all of them.
Can we stay on the PA versus MD topic? Because that's a really popular one.
Yeah, absolutely. Absolutely.
You know, I feel like people kind of in our position, maybe from 10 years ago, 5 years ago, kind of trying to choose PA, MD, should I be a nurse and maybe do nurse practitioner? Like, what do I do? Because once I commit to a path, that's a big commitment.
Yeah.
Less of a big commitment as a PA, which is kind of part of the beauty of it. But you just kind of described that you talked to a lot of physicians and they were all like just not super happy. They said they wish they'd been a PA. And then you talked to a lot of PAs and they were like, I love this.
Absolutely. Right? That was the general consensus in when did I start undergrad? 2014. Mm-hmm. That was the general consensus in 2014 that from my cousin who was a med student or a resident at that time, I don't really remember. And then the general consensus from the residents that I was interviewing and the physicians I was like talking to, I was just like, yeah, like this is not a vibe. And I think at 18, I was just like, yeah, I think respectively, life is like so short to be so sad. Like first, I can't guarantee that I would be sad in medical school. Like I don't know that, but I just know that there is a higher rate of depression, a higher rate of like sadness. I could be sad for 2 years.
That's exactly it. I will say, like during PA school, everybody had some sort of an issue. Whether it was like physical health, mental health, emotional health, like everybody was struggling.
Yes.
Because it's just so hard. Can I imagine doing that for 4 years, or especially like including residency, like 8 years?
Yes.
No, like I would break.
Yes, I would break. I would. And I think like maybe, yeah, there is a light at the end of the tunnel, and like maybe, but I don't think I could guarantee that. So, you know, I liked it. I really, and to this day, like, you know, I think, I don't know about you, but like sometimes I think I'm 28 now, and like, you know, part of me, like once a year or something, I'll be like, oh, should I apply to med school? But then I'm like, then I reevaluate. I'm like, no, I still don't feel like doing this.
Yeah. Well, and being a little bit older, like I started PA school at 29. At that point, I had already done some stuff. I was in the military for 5 years.
Oh, wow.
There was a lot of, like, I was starting late. And so just like kind of looking back on it, going like, well, this doctor's doing kind of the same job as me, and he's making 3 times as much. Like, that sucks. But I can also imagine if I had started medical school, even at the same time as PA school, which is no guarantee, I'd still be in school, wouldn't I? Like I'd be just graduating medical school, starting, you know, my residency soon.
Yeah.
I'd still be like, okay, I'd be a doctor, quote unquote, but I'd be like just starting residency, which is 3 to 7 years of hell.
Yeah.
Instead of like where I am now, which I'm just so happy about. Like I could not imagine.
Yes, I can't imagine either. And I think, you know, I'm so glad that residents, because, you know, obviously, like I worried for my brother a little bit, but like my brother made a very informed decision. And I think like me being a PA helped him make that. He was like, no, I understand that this is the case. But like, I still want to be a physician. I'm like, all right, you do this.
Good. Somebody should.
Not that I discouraged him to be a physician. I just let him know, like, this is what my life is like as a PA. I want you to know that. And then you get to decide what you obviously want to do. What I am really happy about is residents, you know, unionizing. I'm so happy. Like I'm more relieved. Like by the time my brother's in residency, which will be 4 years, hopefully, like hopefully things would have changed. Will have changed, right? So instead of like the 80 hour, I can't imagine, honestly, I cannot imagine working 80 hours in a week. I think that like, if I have to, like, when I pick up a shift, like an extra shift or whatever, and it's like, I'm hitting 60 hours, but at the end of my shift, I'm a little cranky. I'm feeling a certain type of way.
I remember, so I worked with a number of PAs at my last practice. And I remember, I'll never forget, this one girl said, like, yeah, if I pick up 3 in a row, I'm a bitch. Hopefully I can say that on TikTok. And because I was so new at the time, and I was like, I mean, that just sounds like an excuse to like treat people badly. And then I started practicing in the same clinic and realizing like, no, by the third 12 in a row, you have heard so many complaints, dealt with so much paperwork and so much BS and so many staff like being disrespectful and just so much stuff that you're like, you're so over it. So I cannot imagine that like 6 days in a row, 7 days in a row, plus didactic, plus doing other stuff. Yes. Like I would break. I could not imagine. I'm not built for residency.
I'm not. I don't think I'm built for residency either. Not at this stage of my life. No, I'm.
Maybe. Like if you're there and you have to
pay
back
you
student
loans. You have no choice.
Maybe. But,
yeah, if I was already like 200K in debt, I was like, damn, I got to do this. I don't got a choice.
True. Like at that point, like just make the best of it, you know, like whatever. But man, given the choice, like no, thank you.
Yes, I agree. I 100% agree.
And I don't want to put down physicians. Like I very much respect them. If you look through all my videos, it's nothing but like tremendous respect. You know, but could I be one? Probably if I put my mind to it, but I don't want to.
Yeah, I think it's like, you know, I really respect physicians. I just feel bad that this is how they're being treated. And I believe in resident salaries should be like normalized. Like it should be a living wage, and they should have living work. Like they should have a work-life balance. I don't think after working 60 hours, you're learning anything. I don't think you're learning anything. I think at that point, like, how is your brain functioning? I don't even know. Right?
I think it is. People's capacities are much higher than we give them credit for.
Perhaps. I just feel like They need to fix whatever is happening, right?
Yeah.
They need to increase residency slots. They need to either decrease like student loans for them. I just don't think this is I don't think the environment that they're in is normal.
Mm-hmm. No, I completely agree. It's extremely unhealthy, which is extremely ironic, right? Yeah. Our top of the line healthcare providers are just destroying their physical and mental health and training. Yeah. And then when they get to their work. But, I had a thought. Oh, yeah. I remember so I worked with a nurse practitioner at my last job, and his wife is a physician.
Oh, like okay.
ENT or something. And he remembers, because he was already a nurse practitioner or a nurse while she was in medical school.
Yeah.
And he remembers her coming home after like a 14-hour day, treating patients, working, all that. And then she just made a pot of coffee. It was like 9:30 p.m. And he's like, "What are you doing?" And she's like, "I have to read this GYN book and get through it and be tested tomorrow." It was a book, not a PowerPoint presentation, not like a packet. It was a book. Yeah. And she made literally a pot. And she's like, "I'm staying up all night. I'm getting through this book."
Yeah.
It's like, bro, that's so not good for you.
Yeah, that's a lot. That's a lot. A different type of hazing. It's different.
But they do it. They do it.
They do it. They have no choice. But they're like, I think in PA school, like my husband even mentioned, he was like, "Oh, you made it look like I didn't complain during PA school." And I think like the thing is that I was just like, it's kind of like residents. I think there's a point where your brain just kind of goes autopilot. Yeah. Where you're just like, you don't really have a choice but to do it. Like what am I supposed to do?
Yeah.
Like, I was just like, I got to do it. Like,
no,
I'm already 6-figure debt. I got to finish. What else? Like, what am I going to do?
You unlock another layer, and like, it sounds stupid. It's like, oh, just study so hard that your brain just figures it out, but it literally does. It just figures it out.
Yeah, because you don't have a choice. You're like, you do or die. Like that's like you got to do it. You got to do it, or like you will not survive it.
Yeah, and it works. It really does work.
It works. It works for me, at least.
Yeah, likewise. Like I've got one of my pinned videos up at the top of my page is like literally the moment that happened. It was post-bac. It was like 2 hours of sleep, 3 hours of sleep a night for a solid 2 weeks through finals. And like, I did not study for A&P one bit. And then I just studied from like 1 a.m. until 5 a.m. And like, I got a 92. It worked. It was horrible, but it worked.
Horrible, but it worked. Like you had no choice but to do it. You're like, I have to do this. Otherwise, like, like the criteria for fail, like it was very easy to fail.
Yeah.
I think we lost, I don't know exactly why we lost. So I don't know how many people were in your class. We had 40 people and then we graduated with 38.
That's not bad.
Yeah, that's not terrible. But when I first started PA school, I mean, it's nothing like undergrad. It was absolutely nothing. I don't think I was prepared for that. Like, I don't think I was prepared because I was 20, I think I was 23 when I started, I was 23 when I started PA school. Or 22, I don't remember. I think it was 23. And what was I saying? Yeah, the first couple months, I was like, oh shit, I can really fail this. Yeah. Like, and they can really kick me out. Like, it was, I will say, like, I didn't like the whole, like, do or die thing. Like, you got to do this, otherwise you can get failed out and they will kick you out. Because for us, it was like, if you failed, I think it's if you failed 2 exams. No, if you failed 1, you get remediation. If you failed a second, and then you failed that second remediation, they kicked you out.
Yeah, you're just done.
Yeah, you're just done.
Yeah.
Which it made sense because our program was 24 months straight. We didn't have like summer breaks or anything. We had like a week of winter break or like a couple, like 2 or 3 days, 1 or 2 days off for like Thanksgiving and stuff like that. Which makes sense. Like in that moment, they're like, okay, like we don't have a choice because this is like a short program and like you need to know what you need to know.
Yeah.
I don't know if other programs are like that, but yeah, it was scary. I would say it was scary if you didn't maintain like a 3.0 cumulative By the end of the semester, you're put on probation. And then if you scored below a 70 on an exam, that would be like a fail.
I think our programs were structured the same. It was also 24 months.
That's so funny.
And ours did decelerate you. Like there was a chance to decelerate to like the previous class.
Yeah.
Which I think at least one person did. I'm not certain. But it was the same way. It's like you have to have a B or better total, and then you have to have a B or better on every exam. And then there was like ways to remediate, but not much.
Not much, right. I think like if there was like I could be 1,000% wrong, I don't remember. I think if it was like extenuating circumstances, like perhaps someone like got very sick or like,
right.
You know, perhaps they could decelerate. But I think in terms of fail, like I think they booted, which I really felt bad for because, you know, it is still like, even if you get through the first year, that's like what, $50,000, $50,000. That's not
so much debt. And then without the PA salary, you're not paying that crap off.
Yeah, it's very, very tough. Very, very difficult.
Look, that's another thing that's super scary about med school, because I have heard of people like going all the way through and then they like don't pass their boards, or they fail out like their second or third year or something, and they've already accumulated like, bless you. She's a little sick, guys. But they've already accumulated like hundreds of thousands in debt, and now they don't have the doctor's salary. Now what? Do you like defect to a different country? Like what do you do?
I don't know. I don't know.
There's not much you can do.
There's not much you can do. And I really feel for these, I know quite a few Caribbean grads that have made it to residency, thank God. But it's like a thank God, right? It's like, I'm so glad you made it through, because not everyone makes it through to residency, especially if you're a Caribbean student, and then they're left with significantly more med school debt than like a U.S. med student, because I think those are like private loans that you take out.
Yeah, they're more expensive.
And more expensive.
Yeah, my buddy Patrick, who I actually do have an interview with on this channel and on my YouTube channel, he's a Caribbean med student right now, I think second year. And he basically said, like, as a Caribbean med student, you have to accept that you're working 3 times as hard as the average med student, because you really have to be at like the tippity top of all the standardized testing.
Absolutely. Absolutely. You have to be like a very driven.
Yeah.
Like you have to make medicine more than the average med student in your life.
Starter, like you have to really kick butt if you want to make Caribbean med school. You
have to kick ass. Like you can't dilly-dally around. And that's what I've heard from Caribbean, students as well, is that they have to work 3 times as harder, because it is 3 times harder. It is significantly harder for them.
It is.
It literally is. So I feel for them. I really, really feel for them.
Just stuff that like deciding again between like PA and MD or DO, whatever, that's a lot of stuff to think about. Is because like, so this is a pet peeve, but I'm still like on the forums and on all the like pre-PA groups, not nearly as much as I used to be. But like once in a while I see someone go like, I just got accepted, I'm going to be a PA. And it takes everything in my power to not comment like, maybe you will. You know what I mean? Like you probably will, but like don't put the cart before the horse. You just signed up for something tremendously difficult, and people fail out every year. Yeah,
they do fail. Yeah.
And it's the same thing with med school. Like if you fail out of PA school, okay, you have a semester, maybe 2 behind you of debt, and that's it. If you fail out of med school, like that's mortgage level debt.
Yeah, it is.
So it's a risk. You're super gambling on yourself.
Yes. I guess I didn't realize. I was lucky. How many people failed out of your program? I feel like I feel like your experience. I mean, we had 2. I think 1. 2 dropped. I don't know how many people failed out of those 2.
I actually don't know. I know one who had already decelerated previously, decelerated again, and I think maybe she passed the following year. I'm not certain.
Okay.
As far as how many we actually lost, I don't know. I don't think any.
Oh, that's great. That's good. That's
awesome. I honestly don't know. I know that the following year lost like 5 to 10.
Oh.
Yeah.
Was that during COVID?
It was during COVID.
Yeah, COVID really did a number on stuff, on people. I understood that.
Yeah.
Yeah, COVID sucked. Did you go to school like? Uh, did you go to school during COVID?
So COVID hit like, when was it? It was kind of towards the end of didactic, I want to say.
Mm-hmm.
I can't remember. It wasn't clinical year. I think it was like right around the end of didactic and maybe in the summer.
Okay.
It was right around there.
We were, yeah, I think the same thing because I graduated August of 2021.
Likewise.
So COVID hit March, or COVID hit Michigan at least. Everything shut down, I think March of like 2020.
Yeah.
I remember it was such a weird, time.
Yeah.
It was so strange. It was so. And did you go to school in New York or you go to school in Ohio? Oh, you went to school in New York. Oof. I can't imagine. I can't imagine going to school in New York.
It was very stringent, like so, and not just like the laws and whatnot, but like the people took it extremely seriously. So like there was a park. So like me and my ex that I was with at the time I was in school, we lived in this place called Camillus. That's like a big suburb. And there's this like gorgeous park that goes next to a river, and there's like these wide, hiking trails. And people would literally be like walking on the trail by themselves in a mask. And then I would like walk by them without a mask because I'm outside.
Yeah.
And they would like literally like run into the woods to get away from me.
Oh, wow.
Like, bro, like it's not leprosy. And also, even if it was, you're outside. And like people were taking it so serious.
Yeah. I remember this was after COVID.
Yeah.
And I was still wearing a mask and I was in Kroger. And I literally just like walked up to Kroger is just a grocery store.
I know, we got it.
Oh, you guys have Kroger. Okay.
Yeah.
So I don't know if it's like a Michigan thing. I walked up to this lady, asked her a question, and she like took 10 steps back from me. I was like, lady, I'm wearing a mask. You're wearing a mask. Like,
I'm not sick.
Like, it's okay. Like, we're going to be all right. But she was like, no. You go ask somebody else. And I was like, okay, like, that's
so
fine.
I still kind of do that a little bit. Like in a patient room, because we have like these small patient rooms.
That's so different.
And like they're confirmed COVID, flu, they've been talking, they got a fever, they got pneumoniya. And I'm going in there, like, and now I've been like staying like in the doorway, like, hey, by the way, you tested positive for COVID. I'm gonna stay here, talk to you in my N95. Like that's different. But if someone's healthy and you're outside, like chill.
I was like, we're wearing a mask. I'm wearing a mask. I'm not standing next to like super close to you.
Literally.
And it was like after the whole, COVID is, yesterday I found out one of my coworkers got tested positive for, I just tested myself for COVID right now and it came out negative. So I was a little nervous. I had COVID. I was like, oh shit. Like, I hope I don't have COVID. But she tested positive for COVID yesterday, but she wasn't too bad. But yeah, it was an interesting time. It was a little scary. It sucked. We did have a lot of people die. Like, I won't lie. So
I was on my ER rotation when it was like the heat of it.
Oh.
So like more than every other patient was a COVID patient, and that's when you'd like gear up like full PPE, everything, and it was, and then it would be over. You take it off. Oh, got another patient. Is it COVID? Yeah. Strap everything back on.
Yeah.
And we did definitely have people die, and we had people like very sick. So, I mean, I took it seriously. Like it was a real thing.
Yeah, absolutely. Like it was definitely scary. It was scary in the hospitals. It was scary. You know what's funny though? So in my family med rotation, they kind of used us a little bit as unpaid medical assistants, it felt like. And we were used as unpaid medical assistants. So we were just swabbing people. There would be a line of cars and we would just be swabbing. And we had the full gown and everything. We had everything on. And I never got sick. You know when I got sick? Mm-hmm. I started my job as a PA in psych.
Yep.
And I'm like, how does that make, and I'm majority telehealth.
Yep.
I'm like, how does that make any sense that I literally...
Makes no sense.
I was like, at this point, I was like quadruple vaxxed. I think I was at my third COVID shot.
Mm-hmm.
I was working in psychiatry, so I'm not like really face-to-face interaction. I'm not doing physical exams. Majority of the time I'm doing telehealth. Like I want to say like 70% of the time I was doing telehealth. I was in the office doing telehealth, if that makes sense. And one day I came in and I was like, and I had drank I have a juicer and I made like a ginger juice. Nice. And it was like really strong. So I drank it, and like the next day I was like, man, that ginger juice really messed up my throat. Like I must have done it. I don't know what I did, but like it screwed it up. And then I was just like, let me just go check if I have COVID. I was positive. I was like, are you serious? Like
either ginger juice or COVID. It's one or the other.
Yeah, because it was such a weird. The symptoms that I was having was something that I hadn't felt before. Like
it's a weird one.
It was weird. I wasn't congested. I just had it felt like I had burned my throat. Like that's what it felt like. It didn't even feel like a sore throat. It felt like I burned it.
And your head. It was like the weirdest headache.
I don't remember.
Really?
I just remember that I was just like, oh shit. And I was interacting with people thinking I didn't have COVID until I got tested, and I was like, I'm so sorry. This was so stupid.
COVID was such a weird one. It doesn't act like any other virus.
No, it was different for everybody.
Literally, and the symptoms are just so bizarre. And you can have it and not know it, and then you're super symptomatic a day later. But at that point, you got all your friends sick.
Yeah, I'm so sorry. I'm so
right.
sorry.
You have no idea. You didn't feel anything. You didn't even think to test, and now everyone's sick.
I mean, I had some family friends, we had a couple their family had passed away from COVID, so that was really scary. I had classmates whose family passed away from COVID. That was really bad. But then I had other people who were completely, not affected by COVID at all. Sorry, one more time.
It's so just
it's
to each person, whether they even get it at all, how bad they get it. And it's not predictable. A lot of people, sure, COPD, obesity, but not everybody. At all.
Exactly.
13-year-olds got it and they died. Yeah. And it was so weird.
It was weird.
I remember, like I just said, I was in the ER doing my ER rotation in the heat of it. So seeing the sickest COVID patients, and I never got it. And then I got it having brunch with Tom, my friend, who was asymptomatic. He literally asymptomatic. He felt totally fine. And me and him were across the table for at brunch for 2 hours. And that's the worst way to get it, obviously, just sharing a small space. And literally the next day I was super sick, horrible headaches, fever. 2 days later, lost my smell and taste, everything. And then I was like, Tom, are you sick? He's like, no, I feel great. And then 2 days later, he's like, oh yeah, I tested positive, by the way.
Oh, no.
I was like, bro, how did you, he didn't know, nobody knew.
Yeah.
It's the weirdest disease ever.
It is strange. And it's still around. My family, they just went on a cruise. Not my cousins, they went on a cruise and they caught COVID on the cruise. They're okay. Yeah.
Very good. But so looking at my little question list here, we covered Samosaquine, why medicine, why PA, why psych? That's a unique one for a PA. Why psych?
Okay, it's actually really funny because I didn't think I was going to be a psych PA. Here's my thing. During all of my clinical rotations, I liked all of my clinical rotations. Right. So if I ended up, I was just I'm just going to apply to generally the things that I enjoyed, whether it was IM, ED, psych, family med, endocrinology was a little hard to get into because they wanted IM experience. So I called up all the people that I declined on interviews, and I called up the psychiatrist and I was like, hey, I was just wondering, I know I declined the interview, but I was just wondering if I could please come in for an interview. It was a psych place. Are you and this was a CMH, so it was that was a private kind of practice. Whereas this was a nonprofit organization, bigger organization with a little bit more structure, etc.
No job is perfect.
Yeah.
But everybody's got their reasons for leaving. Those are personal. But definitely things to watch out for. I think we call it that is patient safety and also just protecting your license. But first and foremost is protecting your license. If you don't feel like you're safe to practice, patients are safe, bring that up the chain immediately. Yeah, literally. Like you can't, especially as a new grad, like there needs to be a leadership, a management, a training situation. Like you got to make that very, very clear.
Yeah. Yeah. And like the thing is that they were also like, they had promised me 6 months of training, right? But I should have asked, like I was brand new, it was my first job. I should have asked, what does that training look like? What does that onboarding look like? Right? Does it mean like I'm shadowing you the first day? Was it EMR training? Like, you know, like when do I get to see patients? How many patients per day? Like initially. So in my first job, like the psych job, I think it was about 1 to 2 months of onboarding. And that's not really like heard of, to be honest, in my experience, like that long. But it was me shadowing the physician while they were credentialing me, like, because that takes time, right? They're like, so while we're credentialing you, I guess that's the perks of a bigger organization. Like hospital politics, big organization politics suck, but for in this specific place, they can afford to pay you while you're onboarding.
Because a lot of places won't. A lot of places will say like it'll take us 2 months to onboard you, but you're not getting paid.
Yes. Yeah, I think. Yeah. So I was shadowing the physician for like a month-ish, a month and a half. They did an EMR training. I got acquainted with the case managers, the therapists, the schedulers, like, you know, I was going through like I had, you know, in my spare time, I had a couple of books that I would read, like the DSM. I would obviously read the DSM. I was reading Stahl. I was also just old PowerPoints that I had in PA school and stuff. And, you know, so it was like, it was a solid, I would say it was a really solid onboarding. And like, that's probably why I stayed like as long as I did. I don't think it was that long that I stayed, but.
That's one thing that you mentioned is like how much you stood up for yourself. Like, and you literally left like your first day, one of your jobs, you left like your first day because you were like, this is unsafe, can't have this. And then like you were just done because they were willing to put you in that situation, which is hard as a new grad because like we said, like you got student loans, you got all this stuff to worry about. You don't want to look on your resume like, oh, I was at this company for 1 day. People are going to be like, what the heck? That's, you know, but at the same time, the most important thing is defending yourself as a provider and your license. Don't do anything unsafe, refuse to do it.
Yes. And also I didn't put it on my resume because I was like, there was nothing to put on, you know, so, but I did explain like why I declined the interview. I was just like, listen, I was like in a weird situation. Like that was my first job, but I just think that it shows that like, I'm not going to do something unsafe. And if I don't know how to do something, I'm going to ask.
Yes.
I'm gonna ask for help. And I think that's what all new grads should do, is that if you don't know how to do something, especially if go ask. Go ask somebody. Don't be afraid to ask.
Not even as a new grad, honestly. Like I've seen, so when I was a scribe in the ER way before PA school, I saw like gray-haired 65-year-old physicians asking even more gray-haired 72-year-old physicians for help.
Yeah.
Literally, like there was this guy, Dr. Steinman, shout out to Dr. Steinman, like one of the most brilliant ER physicians ever. There was literally guys that were working for 30, 40 years, and they would still be like, hey, Rich, can I use your eruditeness? Quote, literal quote, can I access your eruditeness, which means well-read.
Okay.
Can I access your eruditeness to help me with this patient? And he was like, yeah, of course, what's going on? So like, I don't care if this is day one of your, you know, working as a PA or you're a physician working for 40 years. Yeah. You don't know something, ask. That's just the culture of medicine.
That should be the culture of medicine, because at the end of the day, like as we know, not asking can put someone's life at risk.
Especially in the ER.
Especially in the ER. Especially in the urgent care, in the family medicine, in any setting, you know, and if your provider or your collaborating physician or your environment is not encouraging you to seek help when needed, like that's not a good place.
That's the biggest red flag. I don't care if they're paying you $300K a year.
Yeah.
Don't do it. It's not worth, like, even if you were paid $500,000 a year, it's not worth risking your license, which is going to be that in the next 4 years. Right? Like, it's not worth it, guys, at all. Perfect example. So my first job, which I loved, but like when I started, even seeing like 5 patients a day was overwhelming. Yeah. Completely overwhelming, especially when they had more than one comorbidity. It's like, how am I supposed to do this? And then how do I document it? Like, I was just new, so I didn't know how to do everything. Yeah. And then towards the end of that job, I was seeing 20 in a day, which was a lot, but it wasn't crazy. Yeah. But like one of my, I think, first months there, second or third month, it wasn't the owner, my supervising physician. It was another doctor in the practice who had like back issues, so she couldn't walk around much. And she was like, oh, so on your schedule tomorrow, we're going to have 18 people. And I hadn't seen more than 6. And I was like, no, there's not. And she's like, don't worry, I'll be here if you need help. You're going to get through it. And as soon as she said that, I called the supervising doc. I was like, bro, what the heck? I cannot do that. That's so unsafe. And he's like, don't worry, that's not happening. Yeah. So they tried, like somebody tried to put me in that position. And I was like, no. Like, before something bad happened, it was like, I'm not putting myself in that situation. Yeah. Absolutely not. And they knew I meant it. Yeah. So like anything happens at any point in your career like that, please stand up for yourself.
Yeah. It's not like you will always find another job. And that's like the beauty of being a PA. You know, especially as a new grad, like you can look around. You can seek other opportunities if needed. So I agree. I 100% agree.
Now, the job market for someone even with 1 year of experience, totally different world than for a new grad, because now you've proven yourself, and then like especially in like a certain in-demand field, like totally different beast. Then you can work literally anywhere in the country at any time that you want. Some cities are still going to be more competitive, some specialties, but yeah, 1 year things change. Yep.
I even like, you know what's really funny and interesting? Okay, so I will say for new grads, like there is one regret that I do have. I wish I started off in family med or internal.
I wish you did too.
Yeah, because I did pigeonhole myself a little bit going right into psych, because as much as we have lateral mobility, it is tough to, to apply to other positions, especially in a very psych NP saturated field. True. So I'm the only PA at the crisis center, which is kind of crazy, but they are hiring PAs. And I just don't know why, like, we don't have other PAs yet. I don't know what the reasoning is exactly. But in a lot of there was one job, like Michigan is I would say a more pro PA state. Yeah. Which is unique. But I will say that like there was one company that I used to work for as like a behavior technician that only hires psych NPs. And I was just like, so I think I'm in a unique situation where you're right. Like I didn't realize that not that many PAs do psych.
Yeah, almost none. You're the first one I've met.
Wow. That's crazy. Yeah.
I know a lot of psych NPs.
So I would say if I could go back, I would start off IM, ED, primary, something like that, because you'll learn the basics of psych in IM, family med, all primary care. You'll learn like depression and anxiety, which is like bread and butter psych, right? And maybe you'll learn other mood disorders, depending on where you work, especially if you work in a community health setting or an urban setting, you'll be meeting patients with like a psychotic disorders, and you'll get some familiarity. Yeah. Yeah.
The more you see like aripiprazole on there, at first it's like, oh man, this is something different. And then you just realize they're like normal people.
Yes.
But I do want to get into the psych thing. I'm just going to probably have to end this in the next couple of minutes because I do have
so sorry.
No, you're good. We had a really, really good conversation. I think people are going to get a lot out of this when I post it on YouTube, especially as a long form video. So hopefully we can do this again.
Yeah, absolutely. Absolutely. Sorry, I went off like 10 tangents.
Honestly, I'm super glad you did because like psych BA is such a small like topic that we're going to focus on the next time we talk, but we talked about stuff that's way more applicable to everybody else.
All right, cool. Cool, cool,
EA
cool.
school, first jobs, contracts, like so much valuable stuff. So I'm so glad that you did. I just really wanted to go back to what you just said. So like we did very opposite paths. You went specialty right away. I went generalist right away.
Yep.
I went to internal medicine where literally every single thing that we learned in school was like clicking. It's like, oh, that's what this looks like. And that's how you treat it. And like here in urgent care, it's a lot of the same stuff, but like primary care, much more so. So if I could give any new grads advice, as much as primary care sucks in a lot of ways, please do primary care for a year. Just do it. You're gonna solidify your knowledge so much better than if you went into like dermatology, gastro, psych, any specialty.
Yep.
And then you'll just have that base to play off of for the rest of your career.
Yep. 100%. I agree with that 100%.
Yeah. Like I couldn't imagine. So like being in urgent care for the last year and a half, I'm shocked how much primary care I've already forgot. Even though I did it for a year and a half, like somebody would come in and they tell me a medication and it would jar my memory. It's like, oh yeah, I remember prescribing that, but what the heck is this stuff? I forget because I don't use it.
Yeah.
Well, I could still go back in my little, Google Doc that's literally called clinical practice and look it up and the notes that I took. And it's like, oh yeah, that's what Dr. Rogerbelli would do. Now I know, I remember. Boom. Well, like not having that, I can't imagine switching specialties, if I like pigeonholed myself into a specialty.
Yep. It is definitely harder. Even though I got like after my first year of psych, I did get offers in family med. But I knew that I would be starting at a significantly lower salary. I knew that like it was going to be significantly harder. The only thing I had convinced a family medicine doctor because I was type 1 diabetic.
Did you do insulin?
I was like, listen, I know all of the insulin pumps. I know all of the CGMs. I know insulin management. I love type 2 diabetes, type 1 diabetes, my jam. Like type 2, just because like, type 1s are also dealing with insulin resistance now. So I was just like, all right, like, I am familiar with GLP-1s and SGLT2s and metformin and sulfonylurea and all of that, right? I was just like, I don't like telling people I'm type 1, but like, here's why I would be a good fit.
No, honestly, that's a huge value proposition. Like if you told my old boss, like, hey, by the way, I'm a brand new grad. All I've ever done was psych. I don't remember anything from PA school, but I know everything about diabetes. He'd be like, sweet. So I don't have to refer to endocrinology every time someone like just needs more than metformin. Cool. You're hired. I'm giving you all my diabetics. The problem is those diabetics also have a bunch of other conditions that you're going to have to learn about.
Absolutely.
But you will. You're starting at a tremendous advantage because diabetes is hard.
Diabetes is hard. It's hard for patients. It's hard for providers. Definitely.
I guess since I've managed so much of it, it's not hard anymore. It's just like, okay, here's what you do. Here's the algorithm, blah, blah, blah. Start them here, move up this much. Oh, neuropathy, okay, gabapentin, here's how you dose it. Like, I know all this stuff because I've done it, but it's so scary because insulin can kill you.
Yeah, absolutely it can. It can cause so much, like so many issues.
Right.
Like low blood sugar, hypoglycemia, like just like even I deal with that myself. So
You do more than anybody.
A unit of insulin for me, 1 unit of insulin for me drops me 70 mg/dL. Yes.
You're sensitive.
Very sensitive, right? So, if people like I'll see people be like, oh, just a unit of insulin, it looks so small. I'm like, I don't think you understand how much of an impact
that's a hormone, dude.
This teeny tiny thing does. All right, it's very strong. It can affect you significantly.
Yeah, it's literally a hormone which starts chain reactions in the body that does a lot of other stuff, and some people are so much more sensitive than others.
Absolutely.
And like depending on their stress level, their exercise, their day-to-day activities, it is complicated.
Yes, it varies
so much, and you've lived with it. Like we see the matrix, but diabetes is a complicated one, guys. It's not. I mean, blood pressure is complicated too. Don't get me wrong, but like diabetes is complicated.
Especially when you add in insulin management, it's very complicated.
Extremely.
It can get very scary very quickly.
If someone's insulin dependent, literally, like, your treatment plan today could be perfectly good, but if they take a walk, it can kill them.
Yeah, I have to. We recently went for a hike. We were up in Canada. We were in Banff, Alberta, Canada. I had to stuff my backpack with snacks because leg exercises for me, like things like Stairmaster, or like I'm using my legs a lot, my upper legs a lot, drops my blood sugars so quickly. It's ridiculous. Whereas like running, for some reason, like doesn't do that. But like things like Stairmaster, things like going on a steep incline will drop me very, very quickly. Or like weights, like resistance weights and stuff, that'll drop me significantly more quickly than like just cardio.
I've never heard anyone put it that way, but it does make sense.
I don't know. That's my experience with just myself. So I don't know if that's the case for other people.
And I can't imagine doing that without a Dexcom, because like you're not going to be getting like finger sticks during activity. So like you're not going to know that, and you don't know what your body's dealing with. So like a non-type 1 diabetic or non-insulin dependent, their body would just respond. They'd be like, okay, let's release some glucose. Boom, it's fixed, cool. Or some glycogen or whatever. But yours doesn't. So it's like you do something that requires a little bit of a change in glucose, and you can literally just drop. Yeah. It's so scary and complicated, but knowing how to manage it in primary care is extremely important.
Super helpful. And that's what got me a job offer in primary care, is my type 1 diabetes.
I wonder if you'll ever go back to it. I wonder if you're ever going to go to endo or primary care, because like, you know how to manage this better than, someone not dealing with it.
I don't know. I think you never know. You never know. I'll try to convince somebody maybe one day. Be like, listen, I can do this. You just have to teach me. I have a capacity to learn, so we'll see. We'll see how things go. We'll see how things go for this job, because I've only been here for 4 months.
Oh, okay.
Yeah.
I could see that for you. I mean, like a lot of people, like for instance, I always thought like, lateral mobility, every PA works in like every specialty. And then you get to PA school and all your professors are like, no, we don't. Yeah. Like there's a gynecology PA, she's been there her whole career. And I thought that was weird, but then she's like, no, this is like what most people do. They find something and they stick with it.
Yeah.
But for you, you're in such a unique position. Like you really know psych now. You obviously know diabetes. If you can find the right job, I could see you being a really, really good internist. Oh,
I appreciate that.
Absolutely. Because you've like mastered the two things that are the hardest to learn.
You think so? Huh?
Dear God, yeah. All you have to do is add like pain management, pain management, ortho, cholesterol, and blood pressure. You got it. GI stuff.
I had a pain management job.
Yeah.
Well, mostly we did use a lot of opioids, Suboxone and methadone for pain management. We were working with like really sick patients, like terminal patients. But let me answer your questions about psych stuff, because I went on like 9 tangents.
No, you're good. I'm just going to let you go in like 5 minutes here, because I do have a movie to catch actually with my buddy.
Oh, okay.
But I guess, can we wrap this up and ask you about working as a psych PA? So is it like working as a psych NP? You see psychiatric patients, you manage all the harder medications that I can't do in primary care?
So in the CMH setting, yes, generally when someone, family medicine or primary care will refer to psych, we'll see a lot of the time when their normal depression, when it doesn't look like normal depression and anxiety, when they're like, hey, listen, like I've tried the SSRIs, I've tried the SNRIs, like I don't really know. I've tried these newer meds. What I'll see in primary care, like I think you need to go see a psychiatrist, because this needs to be dealt with
mood stabilizers, antipsychotics.
Just like maybe a further evaluation. So like, how in primary care, you do your physical, you do like a physical examination, right? Like you do when you have a full physical that you have to do, right? With a psych eval, my psych evals were an hour long.
Wow.
So my psych evals in CMH, when I worked in CMH, they were an hour long. And what that meant is that I was looking like, I worked in CMH, so it was a little bit different, especially with Medicaid patients. So they had a whole biopsychosocial report, All right. So I would go through that whole intake, and that whole intake process, I would just read through it at first. And it gave me a general idea of that patient's background, the biopsychosocial background, right? And then in my interview, my psych eval would be almost similar, right? But I would start off with like, you know, how, like you asked, like, you know, what meds you're on. Obviously you ask like any allergies, but then asking like, how many hospitalizations have you had? How many suicide attempts have you had? How many, you know, do you engage in self-injurious behaviors? How long has this, when did this, well, actually starting off with like, just like how if someone had a complaint of like abdominal pain, you start off with like, how long have you been dealing with this for? And, you know, when I was working in CMH, they had a pretty bad trauma history. So a lot of them would be like, well, I've been dealing with this since I was childhood. And I would be like, well, tell me about your childhood. What was that like? And, you know, I'm not really giving like therapy, but it's in a way, like I'm getting to know that patient, like understanding their whole childhood history sometimes. Like, well, you know, my mom died at this stage. My dad was using drugs. I was in the system. You know, I was really depressed about that. I felt abandoned. You know, I attempted suicide at 16. You know, I started using, one of my friends introduced me to like heroin at 17, and then it was just hard for me to get off. And I've just been depressed ever since. And I don't know what to do. These are the meds I've tried. They're not working. And then also like asking about history of manic episodes, and not just saying, hey, have you ever had any manic episodes, right? So some patients will tell me, they're like, oh yeah, I've been diagnosed with bipolar disorder. And then I ask them, what does bipolar disorder mean to you? What does that mean? And then they're like, well, it means some days I'm really, really happy and some days I'm really, really sad. And I'm like, well, what does really, really happy mean? Right? Like, what do you do when you're really, really happy? Do you get out and take care of yourself? Do you like, you know, take a shower and like hang out with friends? Or does manic episode mean other things where you're so happy and you feel on top of the world that you're doing things that are dangerous, that you don't do normally?
Right.
You know, and so it's a really long and big and lengthy conversation. And so that's essentially, you know, that's the nice thing about psychiatry, is that we can dig deep. And then it is medication a lot of it is medication management, right? So determining what is the appropriate psychotropic medication for that patient. So for example, like, you know, I'll have patients tell me, they're like, every, you know, like they won't say SSRI, like, you know, I've tried Zoloft and like Prozac, and then I just start doing crazy things. I just feel on top of the world. Da, da, da. And then you're like, oh, is this like a mania?
That's a bipolar. Yeah.
Yeah. Is this an SSRI inducing a mania? And then I'm like, have you felt that way before as well? Right. So we consider any sort of like other psychotropics to help manage that, to manage the mood instability. So yeah, I would say, you know, and not just that, right? Because when I worked in CMH, it was very much a team. So I think what's unique about psychiatry is that we are working with therapists. We are working with case managers and social workers, right? In the CMH setting. So, you know, when I would talk to a patient and I would say, when did you start feeling sad? And she's telling me, like, you know, my husband's abusive and none of these medications are working, and he hits me, and you know, I don't have any control over finances. And I have to have like a very reasonable conversation with them, saying like, I don't think medications are going to fix what's happening here.
I've heard that, I'm not going to say who it was, but I heard that in like a YouTube video about mental health, where it's like, if your life is, like, sometimes the way you're feeling makes sense because your life is structured in such a way. So it's not a medication thing. It's not an abnormality or an imbalance thing. Like, your life is causing you to feel this way for a reason.
Yeah, your life sucks. Like,
Well, I'm not going to say that, but yeah, exactly. That's exactly right.
sorry, yeah,
Exactly. But,
if that's valid, I think that's validating for patients to hear. I mean,
think
not
so.
like your life sucks. I won't say
No, I
that.
would never say that to a patient, but
I would never
yeah,
say that to a patient.
But real quick, this is like the worst place to end, but the movie does have a start time and I do have to go.
You're totally okay.
So we absolutely will continue this conversation if Maria's willing to come on. And we definitely need to talk about mental health, about psych. Like that's going to be a whole episode.
Yeah.
So hopefully this was valuable to you guys. We talked more generally about being a PA, getting into school. Well, maybe not that, but like failing out of school.
Yeah.
Right. And just first jobs and new grad kind of stuff. But we're gonna get off now and we're gonna do this again now in a week, couple weeks or something like that. And we're gonna talk way more about mental health because this is like the most interesting topic. And I wish we covered it more, but like now I legit do have to go. But we're gonna definitely get back there. Is that okay?
Yeah, that's totally fine. I'm sorry I went on like 10,000 tangents. And like if I said something that was like inappropriate, I'm sorry.
I don't think anything was inappropriate at all.
It was a cool conversation though, for sure. I felt like I was talking to a friend.
Honestly, yeah, likewise. And like this is the kind of stuff, like we said, like when you're working with another provider, you just BS and you just talk about this stuff, which is very valuable for you guys that want to get into this career to hear about. You know, it's very, very valuable. So I really hope people watch the long form when I post this because viewers were kind of in and out. So that's what we'll do.
All right. You take it easy. Have fun watching your movie.
I can't wait. I'm also starving. I'm going to go eat something.
Have fun. All right. Bye-bye. It was good talking to you.